Hello, this is Kurt Eggebrecht. I serve as the health officer of the city of Appleton. I've been in this role for 20 years, but I have 40 years total work experience in health promotion and population health. Yeah, children need both intellectual and physical health to be healthy. And so in our summer programming with our Park and Rec program, their focus is on the physical health, and there's bike trails and activities that are available in the park systems themselves. There's also through our library, the intellectual health. They have book programs and reading programs throughout the summer. So there's a variety of opportunities for families and children here in Appleton. Yeah, so that was a difficult decision, and it was one that took the entire city leadership team in the discussion of that. The state came out with recommendations of not opening pools and sports youth programs due to the number of cases of COVID. We also looked at the physical environment of those activities. And in the pool setting in particular, although we worked very hard to have swim lessons, knowing that's such a vital part of growing up, when we really analyzed it, we found that it was really difficult to have groups of people less than 50. And because of the number of swim lessons that are offered in the summer, the staff leading those activities would be exposed to over 500 children a day. And so when we added it all up, the risk to the employees, the risk to the community at large, that difficult decision did need to be made. We also wanted to be consistent with the State Department of Public Health recommendations at the time of the decision, which was to cancel youth sports and pool activities. And again, that was a view towards reducing the spread of COVID-19 in our communities. Yeah, so masks are a preventive method. And I'd like to preface that the virus is going through the vapors when we breathe. And it's easy for people to see their breath in the wintertime when it's very cold. But those same vapors are coming out of our mouth every day, no matter what time of the year. So what the mask does is really protect the other person, not ourselves, when we wear them. And so our moisture that's coming out of our mouth, if we were to be infectious, we'd be transferring that virus to others. What the mask does is it captures those virus particles in the moisture droplets. And that's what's really helping others, and it's a protective factor. I think that is really understanding the virus and the spread. So what we know through research is that if you can maintain a distance of 6 feet or more and not get close to others that aren't wearing a mask, that's your best protection you can do. I think what we're really looking for is to people to really understand the benefit of it and why we do it and why we ask for that. So for example, the farmers market's going to be educating people on the need to do so and encourage people to use the mask, because the science is really behind it. It really helps reduce the spread of the virus, and that's the reason for wearing them. Yeah, so every local health department follows the same procedures. That's standard procedures. Where let's say we had a case this morning, and we could use an example of someone that is either a hairstylist or a barber, and we identify through lab confirmed testing that they have become COVID positive in terms of the diagnosis. So what we would do, would we get notified, local health departments get notified of all positive tests, and then we would notify that individual and identify when we think that they first became contagious. And so working with them through an interview process, we can better estimate who then they may have infected or exposed others to while they were shedding that virus. And so that allows us then to go back and create a list of people that we reach out to in a confidential manner to say they may have had an exposure, where they in fact were identified to have an exposure of a known person to be testing positive. And we would ask them to be in quarantine, which means that they're well, but they're to monitor their symptoms for a period of time to see if they become symptomatic themselves. These public health nurses have been doing this their entire careers. This is not new to COVID-19. We do this for all Category 1 communicable diseases. So contact investigation is just part of our work. It's what we do every day within public health. So right now we're focusing on COVID-19, but it might have been an active TB case a month ago. It might have been a variety of other illnesses prior to that. So contact investigation is part and parcel with what public health does day in and day out. So if I were to test positive for COVID-19, I would want my family and friends to know so that they themselves can monitor their health status so they don't become ill. And that's really important because the people that we interact with are the people we love and want to be around. So by understanding that risk to those other people is really important. And the only way we can protect them is by allowing the public health nurses to know who those contacts are so they can do a confidential outreach to them.